Post-COVID heart attack in young individuals, it's a growing concern, as we all know. The COVID-19 pandemic has brought to light several unexpected complications, including the increased risk of the heart attacks which has been seen in especially young individuals. This phenomena has left medical professionals as well as researchers scrambling to understand the underlying mechanisms as well as risk factors. Now, first let's see what is the incidence and prevalence. Studies have shown that the incidence of the heart attacks in young individuals has increased significantly since the onset of this pandemic, that is COVID-19. A study published in Journal of American College of Cardiology found that the incidence of heart attacks in individuals under the age of 40 increased by 30% during the pandemic. Now, risk factors, being several risk factors have been identified that may contribute to the increased risk of heart attacks, especially in young individuals post-COVID. First of all, that is inflammation. Now, COVID-19 triggers a severe inflammatory response which can damage the cardiovascular system and increase the risk of heart attacks. And second is endothelial dysfunction. The virus can cause damage to the endothelium, which is the inner lining of the blood vessels, leading to impaired blood flow and increased risk of heart attacks. Then third is the blood clotting. COVID-19 increasing the risk of thrombosis and heart attacks. Then pre-existing conditions. Individuals with pre-existing conditions such as comorbid conditions, diabetes, hypertension, dyslipidemia, high cholesterol, high triglycerides may be more susceptible to the heart attacks post-COVID. Last but not least, lifestyle factors. Sedentary lifestyle, poor diet, and stress may also contribute to increased risk of heart attacks, especially in young individuals post-COVID. Now, how would you actually diagnose based on the symptoms of the heart attack in young individuals may be a little bit different from those actually experienced by elderly patients. One symptoms being, first is a chest pain or discomfort. This may be a dull ache or a sharp pain that radiates to arms, back, or jaw. Then second is shortness of the breath. This may occur at rest or even with exertion. Third is fatigue. This may be persistent. There may be persistent feeling of the tiredness or weakness. And fourth is lightheadedness or dizziness. This may occur when standing up or changing positions. Now, diagnosis is typically made by using a combination of electrocardiogram, that is ECG, to assess the heart rhythm and detect the signs of the heart attack. Then your special blood tests are there to measure the cardiac biomarkers such as troponin and assess liver as well as kidney functions too. Then there are certain imaging tests such as 2D echo, cardiography, cardiac MRI to visualize the heart and detect the signs of the damage. Now let's discuss the prevention as well as treatment. Prevention is the key in reducing the risk of heart attacks, especially in young individuals post-COVID. First is maintaining a healthy lifestyle. Engaging in regular physical activity like eating and also eating a balanced diet, managing stress are two important key factors. Second is managing pre-existing conditions, working with your doctors, healthcare providers to manage conditions such as controlling the blood pressure, controlling sugar, or even high cholesterol. And third is stay up to date on vaccinations, including the COVID-19 vaccine, to reduce the risk of infection and cardiovascular related complications. Now, treatment for heart attacks in young individuals post-COVID typically involves, first is the emergency medical services. That's very important. You should call emergency services like ambulance or nearby hospital if the symptoms worsens or persist. Then cardiac catheterization to restore the blood flow to the affected area of the heart. You need cardiac catheterization, that is percutaneous coronary interventions to manage symptoms, reduce inflammation, and prevent further cardiovascular events. Now, the increased risk of heart attacks, especially in young individuals post-COVID-19, is especially a very much growing concern. Understanding the underlying mechanisms and risk factors is very much crucial in developing the effective prevention and treatment strategies. By maintaining a healthy lifestyle, managing pre-existing conditions, diabetes, hypertension, and staying up to date on vaccination, individuals can reduce the risk of heart attacks and heart-related complications.